Welcome to Dental Business RX. Practice success in 30 minutes or less.
Thank you for calling ABC Dental.
I have a unique episode for you this week. When I sat down to plan this topic out, which is case acceptance related, I did my usual. I had the guts of what I wanted to talk about and started to make an outline. And then I realized this has already been done. Not on the podcast, mind you, but on our online platform, DDS Success. And even better is the person who did it, Dr. Greg Winteregg. Now, I'm sure many of you have at least heard of Greg. Some of you may have had the privilege of meeting him, or even better, attending one of his lectures. For those that are not familiar, some backstory. Greg was a dentist, an MGE client, and then a partner here at MGE for over 20 years. He was also a very good friend. He graduated from IU Dental School in 1981, built a successful practice in rural Indiana, and then became an MGE client in 1992, took off like a rocket, more than doubling in his first year. By 1994, he'd sold his practice to his associate and came on board as a partner here at MGE. And over the next 22 years, he was a foundational part of making MGE what it is today. Greg is and always will be a critical part of MGE's DNA. And I'll tell you something, not a week goes by where I don't see something and think, what would Greg have thought about that? Or Greg would have laughed about that. He was not only a great friend, but a great executive. He would outwork anybody and just generally a pleasure to work alongside. And the bonds of friendship that you forge when you've been through just about anything, especially when it comes to building an organization of this size, are really difficult to replicate. Now, you know how some people are good at many things, but there's one area where you can say no one can match them. They just shine. Well, for me with Greg, it was his ability as a public speaker, especially when lecturing to new clients. Beyond his amazing skills as an instructor, his incredible passion for the dental profession and for dentists themselves was impossible to ignore. You felt it without question. This guy really cared, and you knew it. He really wanted to help you. You just knew. And the subject I most enjoyed hearing Greg lecture about was sales. The guy could sell. But the basis of that ability rested on a combination of caring and certainty, and he freely gave this same skill set to everybody who attended his lectures. You could see the positive change in attendees after just the first seminar session on Thursday mornings. By 2016, Greg had semi-retired and continued to lecture at MGE's communication and sales seminars. With a look to the future, Greg began selecting and training speakers to replace him from our client base as a speaker. And in that, we were highly successful. The doctors you see on stage today at the MGE Communication and Sales Seminars learned from, in my opinion, one of the best speakers that ever walked. And they now pay those same lessons forward that they learned from Greg. When Greg passed in 2021, it was a huge loss, both personally and professionally. I mourn my friend and the ironclad bonds we all had with him. At the same time, however, I looked in admiration at how he not only helped forge what we have now, but ensured it would continue. That he made sure that others would carry the torch forward with the same level of passion, quality, and care for today's MGE clients, as well as the ones that come aboard in the future. The company was not only able to carry on, but continued to expand and help others, and I owe, and we owe, this in a large part to Greg. So if you do come here to MGE, don't be surprised if you see him pop up on a video display, or if you go to MGE's YouTube channel, you'll see that he's featured in a ton of our early tips. Or if you're a DDS Success subscriber, you'll notice that a considerable amount of the sales training is Greg. And it's with that we have this week's episode. As I mentioned, I realized Greg had already recorded what I planned to podcast about, so I thought, hey, let's just give you Greg. So I have the audio from two lessons he recorded on DDS Success. One is called Getting Patients to Want What They Need, and the other is called Caring About the Patient. Now keep in mind, this is audio from video, so you'll hear him refer to in the next video or in the next lesson and so on, and that's fine. This is just the audio. These two lessons, in my mind, will completely change the way you think about presenting treatment, and don't be surprised if they even revitalize your excitement for the profession. And with that, I give you Dr. Greg Winteregg.
Welcome. I'm Dr. Greg Winteregg. I'm a dentist and a partner at MGE Management Experts, a dental practice management training company. And in today's lesson, I want to talk about the case presentation. But let's call it for what it is. We're going to sell the patient. That's why we're having them come back. And I want to take a look at the dental box. So let's picture right here around me plywood about chest high. I have very little room to move. And imagine that the plywood represents rules of engagement, so to speak, of selling the patient dentistry. So the first false idea inside the dental box is that you don't sell patients dentistry. Well, the actual truth of it is, if nobody sells anything in America, then no production, no commerce happens. So we can use a fancy term of case presentation, report of findings. We can dodge around and call it whatever we want to call it. We're having the patient back to sell them the dentistry. And don't think that just because you give it another name and a fancy term, they don't know it. So you can call it whatever you're comfortable with, but inside the dental box, you're not supposed to sell. Now, inside the business box over here, we know that the business owner has to be able to sell the dentistry, or there has to be some salesperson in the company that can sell the product or service. So it's just common knowledge in business that somebody has to sell. And quite honestly, if the owner can't sell the product or service in business, that business is not going to do well. It's probably not going to endure. It's probably not going to survive. So in the dental box, what's another false datum? Doctors don't sell. Doctors don't talk money. That's unprofessional. Doctor, that's beneath you. You shouldn't be talking money with the patient. They would much rather have the financial discussion with your appointment secretary or with your financial secretary. So you go ahead and you go talk about the dentistry and you show them the photographs and you tell them why they need it. And as soon as they say how much, that's your cue to call in your financial secretary. My financial secretary was Sandy. And I had heard from every dental guru, 6 different consultants and management companies, I'm not supposed to sell. So what is our job in dentistry inside the dental box? Our job is to look cool. We've got our white lab coat, our name is embroidered on the pocket, we've got our high tech, we're all digital now, we've got a laser, we got a CAD cam. Over in the corner, that's a saltwater fish tank, right? And so our job is to portray this image of professionalism and we're going to be the patient's friend. Okay, that's fine. But then over here, doctor, if we're taking a look at this from a business standpoint, you got to be able to sell. And what is selling? Selling is telling the person how much it's going to cost and working them through their objections, working them through their stops and barriers. So I have some really bad news for you, doctor. The day you signed your lease, the day you signed the loan, you were in business. And I have to beg you to quit operating on the false data, the false ideas in the dental box that you are not supposed to sell. I'm here to tell you, you have to sell. You must sell. And if you're going to flourish and prosper in the future, you're going to have to learn how to look at the patient and very comfortably say, that will be $3,000, that will be $5,000, that will be $10,000, whatever it might be. You're going to have to learn how to do that. Now, that might make you throw up just a little bit in your mouth. It might make you nervous. But come on, doc. You've done things a lot scarier than looking at the patient and telling them how much their dentistry is going to cost. You put needles in people's mouths. You inject the most sensitive tissue in the body. with a needle. That's a lot scarier than looking at the patient and say that'll be $3,000. You take a 400,000 RPM burr within fractions of millimeters of soft tissue that it would destroy before you could lift your foot off the rheostat. That's a lot scarier than looking at the patient and say, we need to talk about the money. So I am encouraging you to give yourself a break. You can learn how to do this. And the purpose of this series is to teach you how to sell dentistry. I actually call sell the four-letter S word. Like inside the dental box, the term sell is the four-letter S word. Some folks actually consider sell a bigger four-letter S word than the real four-letter S word that I can't say on film. But come on, let's stand back and take a look at this. You have a business. You have to help people. And the truth of it is, if you can't sell them, you can't help them. Now, selling has nothing to do with trickery, deception, overdiagnosing, overcharging. That is all 100% unethical. I am talking about learning a way where you are selling the patient what they need and actually how to get into communication with that patient so they actually want what they need. And in our profession, it's become too commonplace, and I have experienced this myself before learning how to sell properly, that the patient needs 6 crowns, the insurance pays for 2, so we do 2 now, 2 next year, and 2 the year after. And we're really excited if it's November and December, because we can do 2 now, and then in just a couple of months we can get another 2 done. And that is just not what the patient needs. And I'm here to tell you, if you play the 2 now, 2 next year, and 2 the year after game long enough, you're going to get burned. I had it happen to me where I prepped these 2 early in the year, and during the summer, one of these broke. Now, I had recommended they all be done, but the patient comes in now and they're upset because obviously I did the wrong ones. Well, I could stand back now and look at it differently and say, well, they should be upset because I actually should have used better communication and gotten them to want to do the 6 crowns that they really needed. So that is the point, that is the purpose of what we're trying to teach here in this video series, to actually teach you, doctor, how to look at the patient and get them to want what they need. Welcome back. Today, in this lesson, I want to begin to really address your attitude and your viewpoint about selling the patient. And I'm not just going to talk about selling, I'm going to talk about hard selling the patient. Now, prior to getting trained in the Hubbard Management System at MGE, I had a particular definition of hard sell, and it was not good. Hard sell was the salesman taking advantage of the customer, selling them something that they may not need or possibly even want, all for the greater good of the commission for the salesman or salesperson. So hard sell, I believe, has this negative attitude, this negative viewpoint, this negative connotation, that it's the salesman taking advantage of the customer. Now, in the Hubbard Management System, L. Ron Hubbard redefined the term hard sell. And I really want you to look at this slide, because we're going to evaluate this for the next 5 or 10 minutes here, and I want you to start to take a different view. So hard sell is caring about the person, not being reasonable with stops and barriers, and getting him fully paid up and taking the service. Now, there's a lot going on in that one sentence, but let's dissect it and break it down piece by piece. So, first of all, in this lesson, we're going to talk about caring about the person. Now, I believe in order to even be in our dental profession, you have to care about people. I mean, let's face it. We've all done an examination and found last week's lettuce, last weekend's popcorn hull, and periodontal condition that you can smell as you walk into the treatment room. But we proceed to help that person. I think we have the first 4 words covered: caring about the person, caring about the patient. Now, the comma is where we lose it. What does it say? Not being reasonable with stops and barriers, and getting him fully paid up and taking the service. Now, I do have to make a quick comment here. For our purposes in the Hubbard management system, Mr. Hubbard has a specialized definition of reasonable. Reasonable means faulty explanations. So if we apply not being reasonable in the realm of hard sell with stops and barriers, we're talking about not accepting the patient's faulty explanation. You have to determine if the explanation that they are giving you is faulty or legitimate. So this is going to be covered in a whole other video, but just to make a quick point, a patient is sitting in front of you with diamonds and earrings and $2,500 handbag. You say $5,000, and she's like, oh my goodness, I have no idea how I would pay for that. Well, you can be polite and retreat and say, well, then we're going to have to do something else. But then you would have been reasonable and quite probably accepted a faulty explanation. So within the realm of hard sell, we're not going to be reasonable because we care, and we're going to get into many other communication areas here where you can help determine, is this stop and barrier faulty or legitimate, and now you can strive to be unreasonable. So now let's look at the end product where we're going, and then I'm going to spend a little bit of time in a few different lessons on how we're going to get there. But where we're going is the patient comes in, they're diagnosed and treatment planned, whether it's a new patient or a recall patient, and the doctor presents the treatment plan, gets the patient through their objections. I have no money, I'm only doing what the insurance covers. There's a separate lesson on that specifically. The patient pays in advance before any dentistry is done, and then they come in and get the treatment. So inside the business box, this is how it works. You go to Starbucks. You walk up to the cashier. You order your drink. They write your name on the cup and your order. They pass it to the barista. What's the next thing you do? You pay. And then you go stand at the end of the line and you get your food or your drink. Same thing in McDonald's. You walk up to the cashier. You place your order. Computer takes the order, passes it back for the order to be filled. The next thing you do is you pay. In business, this is just how it works. Now, inside the dental box, over here, what do? The patient comes in, we diagnose thousands of dollars worth of dentistry, we deliver the dentistry, we bill the insurance, and oftentimes the insurance company asks for x-rays or a narrative, and we won't get into how long it can take you to get paid. 30 days is ideal, but that usually doesn't happen. So it's 60 days, 90 days down the road, you get the insurance portion. Now you bill the patient because you're being all polite because you weren't going to ask them to pay in advance. And the patient goes, well, you said the insurance was going to pay for everything. Now, you did not say that. I know you didn't say that. But the conversation about the money was had with the patient months ago. They honestly don't remember. They're not being a criminal and trying to rip you off. They've forgotten. And they did assume that the insurance was going to pay for everything. You know why? Because you didn't ask for any money. I mean, it's just kind of logical. If the insurance isn't going to pay for everything, then why don't we at least ask the patient to pay their portion? But we don't, because inside this dental box, we're supposed to be all polite. We're supposed to be worried about being perceived as that used car salesman. And the truth of it is, we're not actually selling anything. We're delivering dentistry, and the patient walks out with it. Let's take the example of going to the grocery store. Someone goes in and they fill the cart up with groceries. They get up to the cashier and they're like, oh darn, forgot my wallet. They push the groceries away. they wave at the cashier and say, "Send me a bill." They're not going to send a bill, they're going to send security. Those groceries are being stolen. Let's take a look at what happens in dentistry. Patients come in, they get thousands of dollars worth of dentistry. We deliver the dentistry, and then we start billing. Hopefully, we get paid, and usually we do. We are delivering services, however, without receiving payment. So it's really just bad business to do it that way, and it then totally sets up the financial secretary to now start making phone calls, have the patient upset. Now we have to disagree or argue about what was said months ago during the consultation. So the best way to avoid this is to get paid in advance, or at least have the patient pay for their portion. And there's going to be another lesson on that, which is going to be its own discussion. So you do $30,000 a month, it's okay and not alarming if you've got $45,000 to $60,000 per month owed to you. That's just unacceptable. That the lab bill's been paid, the staff has been paid, the supplies have been paid, and that is your profit sitting out there. And it's all because we're being very soft sell and very reasonable inside the dental box. So it's time to take a stroll into the business box. Now, are we doing this just for money? Absolutely not. We're doing this to help the patient. I've already mentioned patients don't like needles and drills inside their mouth. They have every intention of showing up at 8 o'clock on Tuesday morning. Your front desk confirms. 4 o'clock Monday afternoon, they talk to the patient, they don't leave a message, confirm for the 2 crowns tomorrow morning. Tuesday morning, the patient wakes up and like, oh man, they start thinking about the needle and the drill, and it vibrates their brain, and they hate that, and all of a sudden, there's that project at work that I really need to get in there, and they take off for work, and they may not even call you. Does that make them a loser, low dental IQ? No, they're afraid. Let's just call it for what it is. So, if you really care about the patient, then you're going to have them pay in advance. So when they wake up on Tuesday morning and they're afraid, they're going to show up anyway. That's the caring thing to do. It's also the good business thing to do. Now, I want to break down one other common thing that happens. I would guess in at least 80% of the practices in the country, it was happening to me before I got this technology and learned how to hard sell. We diagnose 6 crowns. Insurance pays for 2. We do 2 now, 2 next year, 2 the year after. Now let's just stand back and take a look at this from the patient's viewpoint. Doctor says, I need this. I wave my benefit book and say, I'm only doing what the insurance covers. And either the doctor or a staff member changes the treatment plan from here to here, just like that. There's a very polite effort to educate me that I really ought to do this, but I say I only want to do what the insurance covers, and that's readily accepted. Now, what does that tell the patient about these 4 crowns over here we're not doing? It just tells them they're not needed. Now, confront this. What does it tell them about the crowns we are doing? Well, those aren't really needed either, but the insurance is paying for it, so let's just go ahead. I mean, they're taking $50 a week or a month out of my check. I might as well. I mean, you see, this is the effect we're creating on these patients. And then we complain that the insurance company sends them a letter that we're doing unnecessary dentistry. We're the ones making it look like that. Now, also in the letter that goes out to the patients, they're going to be told that we're overcharging. So you let the patient know that normally you get $1,200 for this crown, but because they're on the plan, they only have to pay 50% of $800. Well, what does that tell the patient? We can do the crown for $800. Thank heavens for my insurance plan. It just prevented me from being overdiagnosed and overcharged. I feel sorry for people who don't have insurance. Do you see what we are doing? We're doing this to ourselves. And we're doing it because we're afraid. We're given all this bad advice inside the dental box that we're supposed to be afraid of presenting ourselves as overcharging and overdiagnosing, and out of that fear, that's exactly what we are doing. Now, in the next few lessons, I'm going to be breaking this down on exactly how to be unreasonable with stops and barriers, exactly how and why to get the patient to pay in advance. And I want you to start to really confront exactly what we're doing in our profession, because we actually are making ourselves look like used car salesmen, because in the dental box, that's what we're supposed to be worried about. And that's it for this lesson.
Well, what'd you think? Now, if you listen to that carefully, you'll see that at the core, the whole basis of sales, its very core, is caring. And I can't tell you how much that shines through with your patients. If anything, I hope this information renewed or strengthened your passion for helping them, because you know what? They need it, and you're the best one to give it to them. Again, hope this helps. If you want to find out more information about MGE, you can find us online at mgeonline.com or call us at 800-640-1140. Folks, have a great week, and we'll see you at the next episode.